Jenks High School junior Aiyaz Sayeed is involved in a wide range of extracurricular activities, organizations including TSA, Science Olympiad, HOSA, Mock Trial, Speech and Debate, and Jenks ISP. He also serves as a chairperson on the Youth Advisory Board dedicated to opioid abatement, where he has learned how deeply lived experiences shape public health and lived experiences, outcomes, and long-term recovery efforts overall. As substance use continues to rise, Aiyaz has become increasingly interested in the gaps within society's current health responses. Today, he will examine the limitations of one-size-fits-all solutions and challenge the audience itself to consider why more personalized, adaptive approaches are much more essential within the healthcare system today. Please welcome Aiyaz Sayeed to the stage.
In 2023 alone, Tulsa County reported 298 fatal overdoses, a 148% increase since 2019. Those 298 people all had a life ahead of them. And yet, in that same year, statewide, we lost 1,375 Oklahomans to drug-related overdoses. 1,375. For context, that's the size of some towns here in this very state, completely wiped out. Let that sink in. So naturally, we as a society, we responded. We built certified community behavioral health clinics across Tulsa County. We expanded medication to opioid use disorders. We then expanded and distributed naloxone at levels we never have before. And we waited, and we watched, expecting numbers to move. But according to Healthy Minds Policy Institute, a non-partisan public health research organization based here in Oklahoma, they state that about 77% of Tulsa County residents who need substance use treatment are not receiving it. 3 in 4 people still not reached. And so many individuals come to the conclusion, well, we've made these programs, we've funded the infrastructure, and if people aren't using them, is there really anything we can do? And the more and more I research this, whether it be an AP seminar, or an AP research, or even in my own time, trying to write a speech, one pattern became clear. Communities with a low socioeconomic majority had addiction programs available. They had mental health programs available. However, utilization rates remain at an all-time low. Everything pointed to the fact that people in these communities just didn't use what was there. But my perspective changed when I joined a youth advisory board that focused on opioid use abatement. I sat in rooms with individuals from communities just minutes outside of our zip code, and the differences were stark. They stated that programs were ineffective not because of that they didn't want help, but because that they didn't fit with the customs, their lifestyles, and how they grew up. Every individual in that room had different needs, and yet we kept handing out the exact same solution to everyone, expecting it to work. Except it didn't. And nobody asked why. So to better understand what leads to the inefficacy of these public health programs and policies, we're first going to put our safety goggles on and examine what solutions we have in place and how they are rated. Then, we'll pull out our measuring scales to weigh the detrimental effects of one-size-fits-all policies before lastly, we make history by building a solution that leaves no one behind. at Yale University, she explains that these programs are designed around outcomes in which that they are defined by investigators, not by patients who vary into outcomes that matter most to them. This is what leads to the creation of the one-size-fits-all approach. It assumes that everybody in the community faces the exact same barriers, has the exact same needs, and needs the exact same answer. And this, from step one, you see it leads to the creation of solutions that on paper seem to work after reviewing numerics and data, but in reality don't take into consideration of how people are living. That is where lived experience comes in. Lived experience captures the first-hand knowledge of navigating barriers, something that a data point cannot hold. A number can tell you that 77% of individuals are not receiving treatment, but a lived experience tells you why. And here's some of that why in Tulsa County. According to the Tulsa County Community Needs Assessment published in 2025, it tells us that most substance use treatment facilities are found within the city of Tulsa. However, half of Tulsa County lives outside of it. These clinics are often difficult to reach, especially with public transport. If you don't have a car in Tulsa County, the system does not do enough to reach. And this landscape is the reason why we see so many overdoses and so many overdose deaths. That same 2025 report goes to explain why we see such numbers. It explains that in 2024, half of the overdose deaths involved multiple drugs, including the mixture of opioids and methamphetamine, and more individuals turn to these substances in order to cope with untreated mental health challenges. These individuals are not giving up. It's the system that's failing to reach them. But you see, as a society, don't you think we have a moral obligation to ensure that every life is protected? That no matter where you live, who you are, how much you earn, that you deserve a real shot at care? Is it right that we make a program, a system, and call it good, and yet 3 in 4 people are still falling through the cracks? Because at that point, you're not solving a problem. Instead, you're solving your own conscience. When people don't have access to adequate care, they'll turn to anything and whatever gets them through the day. And when that becomes substances, addiction deepens. And when addiction deepens without intervention, well, it leads to death. So I ask again, is it right that we've let this problem perpetuate? Do we realize what burden we are passing on to future generations if we let this issue continue? Is it really worth it? So it begs the question, what can we do? Well, according to Megan Reed, research assistant professor at Thomas Jefferson University, she explains that we need to engage individuals with lived experiences in order to build more effective programs. It allows these individuals to be the experts of their own lives. And when we have the individuals who are impacted by these programs, it allows us to utilize them in a more effective capacity. These individuals need to be in the rooms during the development of the phrase, not after. That way we can listen to why they can't access certain resources, we can collect their data and utilize it as qualitative data, use it parallelly to quantitative data in order to make more diversified solutions that address a wider range of needs. I want to go back to the 1,375 old homes we lost in 2023. 298 of them here in this community. And I want you to sit with that for a second. Not as numbers, not as data points on a graph, not as statistics, but as people who woke up one morning with places to be, with families to go back to, with future people who have futures to that never became a reality. Now, we can only mourn the loss of these fellow Americans. Tulsa County carries one of the highest overdose of death burdens across the entire nation, a number that has only worsened since 2019. And behind every increment to that number is a person, a real person. So when we include the perspectives of individuals who are affected, not only do we build more effective programs, but we also become capable of saving the lives that we could have once done. So let's listen and let's build